I was born at St. Peter's, delivered by a nurse named Melissa. The doctor was occupied and didn't make it. She went a little quickly, so it's very appropriate I'm back here working. From a very early age, I always just loved babies. I told my sister at the age of 5 I wanted to be a baby nurse. So I do a lot of younger families, working with a lot of new babies. I am a lactation consultant as a specialty, so I have patients in my practice that I help support through their breastfeeding journey when they choose to breastfeed, but then I also see patients specifically for consults for lactation when breastfeeding isn't going exactly as they planned and they need a little extra support. So the patients are in charge, I'm their consultant. I like to see what their concerns are, how they'd like to proceed. I really like to let patients kind of lead their care, they direct it, they tell me what they'd like to do with it. I would say the majority of my practice is probably younger families with it, but still I see patients of all ages. And that's one of the reasons I like doing family practice, is I really love that holistic centered piece of the family care. I'm not just seeing the mom and the baby, but the dad, the siblings, grandparents, aunts, uncles, cousins. I just love that connection of having the whole family in. So it's really a pleasure to take care of everybody in the family and get to know them all. Being a mother of 3 kids, I've definitely gone through a lot of different parenting challenges and learning lessons, and understand where you need that extra support and education with it. I'm letting parents know when things are going hard or difficult, or they have questions or concerns, that I've been there and experienced that. I try to be as empathetic as I can towards them, because sometimes it's hard.